Hey guys, it's Paulo, and I'm going to be talking about environmental lung disease. So, what is it? Environmental lung disease can be defined as a disease caused by harmful particles, mists, vapors, or gases that are inhaled, usually while people are at work. If the disease is due to an inhaled particle, the term pneumoconiosis is commonly used. Here are some examples of environmental lung diseases. Silicosis is a lung fibrosis caused by the inhalation of dust-containing silica. Asbestosis is a lung disease resulting from the inhalation of asbestos particles, which can be marked by severe fibrosis and a high risk of mesothelioma, which is a cancer of the pleura. Coal miner's lung has many different names, including black lung disease, coal miner's disease, and coal workers' pneumoconiosis, or CWP. And this is caused by long-term exposure to coal dust. Environmental inhalation exposure is increasingly being recognized as a non-smoking cause of COPD. Exposure to occupational airborne particulates caused an estimated 386,000 deaths globally, including pneumoconiosis and almost 6.6 million DALYs, or disability adjusted life years. This is the sum of years of potential life lost due to premature mortality and the years of productive life lost due to disability. So, what are the risk factors? Really, the only risk factors include exposure to the unsafe particles, smoking, or frequent exposure to secondhand smoke. At the bottom of the screen are just some examples of things that can cause environmental lung disease. So how can this be screened or diagnosed? The physician will review medical history and perform a physical exam to determine the cause of the occupational or environmental lung disease. Additional tests include studies of the fluid, tissues, and cells of the lungs, blood tests, bronchoscopy, chest x-rays, CT scans, and pulmonary function tests. Depending on the lung disease, the physician may prescribe antihistamines to treat allergies, or even bronchodilators to open up the lung passages. A lung transplant may be required in more serious cases. Because these diseases affect the lungs, the patients may present with chest pains or tightness, a cough, irregular breathing patterns, dyspnea, or a noticeable increase in the work of breathing. These symptoms, however, may vary depending on the type and severity of the disease. When auscultating the lungs, you may hear abnormal sounds such as rhonchi, crackles, wheezing, or even stridor. When working with a patient with environmental lung disease, there's a chance you will not be the only professional working with the patient. You may be working indirectly with a thoracic surgeon, an oncologist, a pulmonologist, or imaging experts. Because of this, you must be mindful of proper communication to make sure that everyone is on the same page and you can avoid any mishaps. How can this affect the body? Overall, it can decrease the amount of oxygen that circulates throughout the bodily systems, like the brain, the muscles, the liver, etc., everything. The body needs oxygen for food digestion, movement, thinking, again, everything. So as lung function decreases, the amount of oxygen available to the body also decreases, which overall is just not good. So what can you do to maybe help prevent these diseases from happening? If you smoke, you can try to stop smoking. You can wear protective masks when around airborne dust and irritants. You can evaluate lung function spirometry according to your physician's instructions to familiarize yourself with lung function and watch for changes. You can eat a well-balanced diet, exercise, get plenty of sleep. You can hire an occupational health expert to investigate your work environment, and if you need, you can do O2 therapy. The plan of care would depend on the severity and type of disease, along with the goals of the patient. Physical therapy treatment is part of a pulmonary rehab program that helps individuals achieve their optimal level of activity and function. Exercises can include breathing training methods such as diaphragmatic breathing, pursed lip breathing, and breathing combined with trunk movement along with physical activity to help patients get through the periods when they feel short of breath. Exercise training can include aerobic exercises like walking or using a stationary bike. And muscle strengthening exercises for arms and legs will also be beneficial. So, what are the effects of environmental lung disease on exercise tolerance? Again, it would vary depending on the severity and type, but you may see decreased oxygen levels, shortness of breath, especially with exercise, or maybe even without, maybe at rest they're still short of breath. The patient may need frequent rest breaks during their exercises. It would also be important to monitor the vitals to make sure the patient is still safe to continue. So, just like the plan of care and the exercise tolerance, the short and long term goals would depend on severity and type of the disease and the goals of the patient. So, for example, if the patient has difficulty walking, a short term goal may be for them to ambulate 50 feet at supervision on a steady surface without fatigue so they can walk around the house. I don't know. A long term goal could be for them to ambulate 150 feet on a steady or even on grassy surface so that they can walk outside. Another example for a goal could just be for them to increase their overall activity tolerance. So if during the treatment the patient feels, short of breath, if they get fatigued, maybe dizziness, chest pain, or if their vital signs, fly to some abnormal numbers, it might be a good idea to sit the patient down and let them rest. Check the vital signs, make sure everything goes back to normal. For example, if their pulse ox drop to, high 80s or mid 80s, sit them down, see if it goes back up to, the 90s, whatever the normal range was. And you can even ask the patient how they feel and determine if you want them to continue with the exercise or to terminate it for that session. So the studies I found were about COPD. Environmental lung disease is a broad term, but the pathology is basically the same, so I figured studies on COPD might still be relevant. So in this study, they did a randomized controlled trial. The inclusion criteria admitted patients with stage 2 COPD, both male and females between the ages of 40 and 70. The St. George Respiratory Questionnaire, or the SGRQ, was used at baseline and post-treatment to evaluate functional status and quality of life of the COPD patients. The experimental group received PT along with medical treatment, while the control group only received the medical treatment. So the chest therapy with the PT consisted of pursed lip breathing, chest expansion exercises, deep breathing exercises, active cycle of breathing technique, and general chest care guidance. The post-treatment shows improvement in respect to the SGRQ score, which indicates that chest PT combined with medical treatment has more beneficial effects in improving functional status, including a decrease in pain, an improvement in ADL and quality of life as compared to standard medical treatment alone. This article talked about physiotherapy in patients with COPD. The inclusion criteria admitted patients with clinical and paraclinical proven COPD, both males and females, smoker and non-smoker. The 6-minute walk test and the Borg dyspnea scale and the MMRC scale were performed before and after. Exercises include the teaching of correct physiological breathing, diaphragmatic breathing, and breathing during exercise. Forced exhalation like coughing, and gymnastic exercises for chest, abdominal, and back muscles were also performed. The results of this study reveal a positive effect of physiotherapy on physical tolerance and the level of dyspnea after physical exertion and activities of daily living. This last article I found was about the effects of physical therapy on respiratory function in patients with COPD. The evaluation of physical capabilities were performed using conventional tests with a load, such as treadmill test and the 6-minute walk test. Exercises included active rehabilitation exercises, morning hygienic gymnastics, breathing exercises, therapeutic walking, posture training, static and dynamic breathing exercises with an emphasis on exhalation, breathing through clenched lips, stationary bicycle. The tension of certain groups of muscles was also used as an isometric exercise. The results of this study showed that the use of physical therapy in patients with COPD has led to increasing functional capacity of patients expressed by increasing average values of indicators of lung function. And here is a list of my references. Thank you.